breakfast. I already gave my daughter her bottle. She's still getting some formula, but we're switching over to a variety of milk. But this morning for breakfast, I'm gonna give my son some of this cereal because he's very particular with his food. And with my daughter, we're gonna do some quinoa flakes with some fruit. Some flax, this is flaxseed, ground flaxseed, and I like to add some of that, chia seeds, hemp hearts, whatever I try to. I'm making your cereal, buddy. We try to boost the nutrient content, so hopefully you won't really care. So this is the consistency of the quinoa flakes. It's kind of like grits. Definitely tastes like quinoa, so I tried to, with a lot of fruit. Sometimes I'll add maple syrup to give it sweetness. Chia seeds. I like to put all my seeds in kind of cute glass jars, and I put them on the counter just to make them more easily accessible for me. For mine, a little splash for her. I usually do frozen fruit, but today I'm not doing that. Like melted frozen fruit, rather. I'm just crushing her blueberries. There's my daughter's. There's mine. Hi, Mama. Don't mind me, I just woke up. I love this brand of soy milk. Eden soy, unsweetened. It has ingredients: purified water and organic soybeans. Literally the best that I've found in regards to soy milk. And soy milk or soy products, good quality whole soy products are great for you, especially for the prevention of cancer. So just throwing that out there. Finishing up my breakfast with my daughter. I will say my son ate really well. He doesn't always eat well. He's very picky, and I do my best to try to incorporate healthy stuff, but I also just try to keep a balanced mindset with him because I just want him to eat ultimately, and he is very picky. But as long as I can he loves fruit, so I always incorporate fruits with his meals for the most part. And that makes me feel good. And like you saw before, like if I can sneak in some kind of healthy nutrient, I will. But I also don't like to like completely blindside him because he won't like it and he'll get thrown off. My daughter will eat anything right now, so she's literally eaten everything I've given to her. But right, you're so cute. Yeah, like I was saying, I do my best with my kids to try to incorporate healthy food, a diversity of food. It's not always easy. I just try to give myself grace and be balanced, and that's all you really can do. You know, no one's 100% healthy or perfect at anything, so I try to not be hard on myself, but I do want to try to instill healthy habits. I am on my way in to get my Zoladex injection. I live super close to my infusion center and where I get my Zoladex injection, so it hasn't been super inconvenient for me. I know it can be for some people because you're going every month, but most of the time, unless there's a long wait time to get in, it usually goes pretty quickly. But it looks pretty busy today given that it's Monday and it's the morning. People are in there for everything, so hopefully it's not too long, but we shall see. So injection's done, blood work's done. I'm actually very curious to see what my blood work looks like because I haven't been on Verzenio for 3 weeks. Pore access, they obviously do like a sterile setup, so you have to wait. They clean it off. take a deep breath, they stick the pin, try to get blood. They'd probably do flushes. I think they do a heparin flush, which helps break up any clotting that was there. I'm not sure if they do that every time though. Then take the blood, do another flush, tape you up. And it's super simple. But I'm getting rid of that soon. And then, let me see. There's my Zoladex. Oh, it's bleeding. But Zoladex injection there. And that's super quick too. And honestly, I will say that it depends on who's doing the injection, because there's times it's literally been painless because you have to go fast. You have to, there's like a deploy in the injection. So they have to be able to like do it fast, flick their fingers to like deploy it and pull it out really fast. And you will not feel much, to be quite honest with you. The worst part is probably gonna be your anticipation of it. But if you're slow, you can't really like, you're not used to the maneuvering, the patient's probably gonna feel it a little more. That goes with any needle. You don't wanna do any injection slow. And I feel like, you know, as a fertility nurse, a lot of our patients, or all of our patients, are essentially getting injected or injecting themselves every day. And one thing I tell everybody, especially the husbands that are doing it, is do not go slow. Go fast. You do not want to like just elongate that injection. It's that's torturous. So today my nurse, who I've had before and I've known she does it really well, just so fast and like literally painless. So I know a lot of people are scared of the injection because it's so big. The needle is so big. It really depends on who's giving the injection, I feel. Use that information as you will, but I know you can't always ask for the same person, and you have to kind of figure out who's good at what and whatnot, but it's not the needle itself that hurts, it's the injector. It's been a whole year since I've taken Zoladex. Literally, it's been a ride. I remember anticipating the start of Zoladex. I absolutely did not want to, and it was definitely adjustment on my body, but honestly, over time, so it wasn't as drastic and as instant as I had imagined it to be, which is what I think I was more fearful of. Like, I didn't know what to expect. But being a year out, I'm very happy I'm a year out, and about maybe 9 more years to go, unless I get my unless I have surgery, but that's, again, we're not sure what's going on there. But yeah, so I think that's something to celebrate. So yay for a year on Zoladex, year down on Zoladex, and getting a full 12. Actually, I think it'll be 13, and I think I've got 13 official injections of Zoladex, so it's crazy to think about. I feel like I just was diagnosed like a couple months ago. You know, like the time frame I'm lost on. Even when I think about how long I've had my expanders in my chest, like it's just like, it's crazy to think about, because there's this period, like when you're going through it and then going through the active treatment and just diagnosed, like time takes forever. And like the before cancer and the after diagnosis just seems so distinct. Thinking I'm a year out from my Zoladex injection, I feel like I recently finished my chemo and recently finished my radiation. Technically, I still finished my radiation this year, but I was diagnosed in early 2021. I don't know, like I just can't believe the time frame here. I'm getting so confused right now. But anyway, I've chosen to make every milestone and everything that I have gone through as like a celebration. Okay, I'm a year out from this. So I'm a year out from starting my Zoladex and anticipating that. Like I don't have to anticipate that anymore. I've been doing it. So I am super pumped about knowing that already, and knocking some time off on that. So